Hello students, today we are going to discuss a new drug Ceanothus Americanus. This drug is not given in alien. I will discuss it from boric Materia Medica and from S.K. Dubey. It is also not given in NAS. So Ceanothus Americanus, common name New Jersey tea. This remedy seems to possess a specific relation to the spleen. Specific relation to spleen, like specific for liver we have read already, Cardus Marianus. So this remedy is specific for spleen, Ceanothus Americanus. Ague cake of malaria. A left sided remedy, of course left sided. Spleen is in the left hypochondrium. 9 anatomical parts of stomach, spleen in left hypochondrium, liver in right hypochondrium. Anemic patient where liver and spleen are at fault. For anemic patients also, liver and spleen are at fault. Chronic bronchitis with profuse secretion. Marked blood pressure reducing power. This remedy is very much useful to lower the blood pressure, lower the hypertension. Active hemostatic, materially reducing the clotting of blood. So this is about general information written in boric Materia Medica. Abdomen, enormous enlargement of the spleen, splenomegaly. Splenitis, inflammation of spleen. Pain radiates up the left side, radiating type of pain and on the left side. Deep seated pain in the left hypochondrium, that spleen in left hypochondrium, spleen line. Hypertrophy of spleen, that is enlargement of spleen, increase in size of spleen. Leukemia, violent dyspnea, breathing difficulty. Menses profuse and yellow, weakening leukorrhea. So this is for female symptoms. Menses profuse and yellow, weakening leukorrhea, unable to lie on the left sided. So aggravation on lying on painful side, because pain in the left side. So lying on painful side. I am writing here. Pain in the liver and back. Rectum, diarrhea, bearing down in the abdomen and rectum. Next, urinary symptoms. Constant urging to micturate. Patient have constant urging to pass the urine. Green, frothy, contains bile. So green, frothy, contains bile, sugar, jaundice and diabetes. In diabetes, urine contains bile, sugar. Urine green, color is green, frothy type, contains bile, sugar in jaundice and diabetes. So constant urging to urinate. Modality, oars motion, lying on left side or lying on painful side. So this is aggravation. And relationship comparison, all written in here. Chronic cases. So I am coming to S.K. Dubey Materia Medica, Ceanothus Americanus, common name New Jersey tea, and belong to the family Compositae family. So this drug belong to Compositae family. Comment me another drug belong to Compositae family. Its prover is IC Fanestock. IC Fanestock prover. Prover name. So clinically, for we have already read chronic bronchitis, diarrhea, intermittent fever or malarial fever, jaundice, splenomegaly, spleen affection, leukemia. Ceanothus is a spleen remedy par excellence and suited to anemic patients where liver and spleen are at fault both. It is good antidote to malaria. Dr. Burnett, Hale and P.C. Majumdar proved its efficacy in a number of cases of malaria and in other diseases where spleen is affected. So, in malaria, its efficacy is proved by Dr. Burnett, Hale, and P.C. Mazumdar, where spleen is affected. So, splenomegaly or spleen affection associated complaint with malaria. Its indications are pain, inflammation, enlargement of spleen with fullness in the left hypochondrium, chilliness and shivering, principally down back, and dyspnea and palpitation on exertion. All symptoms are aggravated by motion. Aggravation from motion, a very famous remedy. Comment me, aggravation from motion, and lying on left side. Liver, pain and fullness in region of liver or lying on right side. So, if there is pain in liver, then the aggravation from lying on right side, and if there is pain in spleen, then aggravation from lying on left side. So we can say that on conclusion that aggravation lying on the painful side. Urine, constant urging to urinate. Urine is green, frothy, contains bile, sugar, maybe in case of bile in case of jaundice, and sugar in case of diabetes. There may be diarrhea with bearing down in abdomen and rectum. In chronic cases of malaria, kala jar, especially when spleen is enlarged, it is beneficial when given in low potency. So, all about this drug, I am revising and summarizing. Ceanothus americanus, proven name IC Fanstock, common name New Jersey tea, family Compositae family. All about this drug, Dr. Burnett, Hale and P.C. Majumdar proved its efficacy in the malaria where spleen is affected, and indication are pain, inflammation, enlargement of spleen, fullness in the left side. Urine symptoms, constant urging to micturate. It is also very useful in anemic patients when spleen is affected, and marked blood pressure reducing power. It has marked blood pressure reducing power. We can think of this remedy. Deep seated pain, radiating pain in the left side, violent dyspnea, unable to lie down on the painful side. So all about this. Urinary, constant urging to micturate, want to pass urine constantly. Color green, frothy type, contains bile, sugar. And modalities, aggravation from motion and lying on left side. If there is pain in liver, aggravation from lying on right side. So aggravation from lying on painful side and aggravation from motion. So thank you.